Good morning, ladies and gentlemen. It is my greatest pleasure this morning to invite you to participate in our lunchtime lecture, our virtual lecture, where we have an esteemed panel that will be discussing our topic today, empowering communities to take charge of their own resilience. My name is Simon Aline, Program Officer at the Department of Emergency Management. And this morning, this virtual lecture is facilitated by the Department of Emergency Management, and we are right here live today at the Christie Conference Room at the Barbados Light and Power in the Garrison St. Michael. So we want to thank the Barbados Light and Power for giving us the use of this lovely facility. And we want to thank all of those who are joining us online at this point, because you understand the importance of disaster risk reduction at the community level. So this month, the month of March, in our calendar at the Department of Emergency Management, has been designated as the Coastal Hazards and Earthquake Smart Month. So for the month of March, we will be doing a number of public education and awareness activities to inform you more about coastal hazards. I know every year we get the information between June to November about hurricane preparedness, tropical storm preparedness, and so on. But we find it very important due to the fact that the Caribbean region is prone to multiple hazards. Of course, we would know a couple years ago we would have experienced the ash fall because of the eruption of the volcano in St. Vincent. Therefore, interventions such as this one are designed to increase our public awareness on multiple hazards. Today in particular, we are discussing the ways that we can engage our communities and those persons who would be involved at the community level and organizations, non-governmental organizations that have a role to play to ensure that their membership are aware of how to be prepared for multiple hazards. So today, we are doing our part to increase public awareness. We have a number of initiatives for the rest of the month of March. We have our Run Tsunami Run 5K Run and Walk that will be in beautiful Bathsheba, St. Joseph. And we're going to be there on Sunday the 23rd, I believe, Sunday the 23rd of March, as well as our Adopt a School program, where we will be working quite closely with the pupils and teachers of the St. Lawrence Primary School to give them more information about the coastal hazards that will be facing them, being a school that is placed on the South Coast. So our panel this morning, we have Captain Robert Herwood. He is the Deputy Director of the Department of Emergency Management. We also have President of the Barbados Association of Retired Persons, Marilyn Rice Bowen. And we also have our DEM consultant for DEOs in the community, Mr. Selwyn Brooks. So we want to take this time to acknowledge our panelists and welcome them to be a part of this very meaningful discussion. Captain Robert Herwood is the Deputy Director at the Barbados Department of Emergency Management. He's a disaster management professional who has been in the discipline for over 20 years. During this period, his tenure included a program manager at the British Virgin Islands Department of Disaster Management with responsibility for the territory's community preparedness program, a disaster management consultant to the Barbados Ministry of Tourism in order to prepare and test their SOPs and establish the Tourism Emergency Operations Center for Cricket World Cup 2007. And also he was a program officer as well as senior program officer in the Preparedness and Response Department at the Caribbean Disaster Emergency Management Agency, their coordinating unit with responsibilities for training, planning, regional response, including the CARICOM Disaster Relief Unit, and coordinating the update of the regional response mechanism. He has also been professionally trained in several areas in disaster management, to include FEMA's Community Emergency Response Team Training, damage assessment and needs analysis, urban search and rescue, light level, incident command system, and critical incident management, and Emergency Operations Center operations. Captain Harewood is a member of the Barbados Regiment and Reserve of the Barbados Defense Force, where he has been a member for the past 40 years, serving in various capacities, and is a recipient of the Barbados Defense Board's Commendation, the Efficiency Medal, Efficiency Decoration, the Queen's Diamond Jubilee Medal, and the COVID-19 Humanitarian Medal. Please welcome our Deputy Director, Captain Robert Harewood. Marilyn Rice Bowen is a long-standing member of the Barbados Association of Retired Persons, BARP, who was elected as a director of the association in 2017 and elected to the position of president in July 2019. She was re-elected for a third term at BARP's annual general meeting in July 2023. Ms. Rice Bowen is fully committed to realizing the vision of BARP, which is ensuring that seniors can live their lives with independence and dignity. In her role as president, Marilyn represents BARP on various national committees where she advocates for and contributes to policies and practices benefiting seniors. She has intensified the advocacy as she heightens the awareness of elder abuse and the devastating impact it has on the social landscape. In pursuit of this, she challenges outdated beliefs and sparks new insights that allow seniors to adapt to the new reality of aging. Marilyn is a former president of the National Organization of Women, Barbados, now, and the Caribbean Women's Association, CARIWA, and has worked extensively with women to ensure that their human rights are not violated. Her tenure in service includes representing local and regional non-governmental organizations, pursuing rights for the youth, women, and other disadvantaged segments of the population. A Justice of the Peace, she was awarded the Barbados Silver Star in 2013 for meritorious community service. Marilyn is a retired financial advisor and has been a staunch advocate for social justice for over 4 decades. Please welcome Ms. Marilyn Rice Bowen. Mr. Selwyn Brooks has approximately 20 years of experience in disaster risk reduction. He is a former chairman of the St. James North DEO. He is currently our consultant for district emergency organizations, so his portfolio would include ensuring that the 30 DEOs across Barbados are up and running and functioning. He has done significant training with the DEOs. Annually, there are a number of initiatives that he would coordinate with the DEOs across the zones, whether it is in fire suppression, in chainsaw safety and management, communications, and EOC operations. So Mr. Brooks is also a member of the BDF Field Medical, and he works extensively in Barbados to assure that our DEOs are functioning. Please welcome Mr. Selwyn Brooks. I want to encourage those of you who are joining us online, if there are any questions you have for our panelists, please feel free to share your questions in our YouTube page, and we'll be able to answer those questions today. All right, so as the moderator for today's panel discussion, I'm going to start with Captain Robert Harewood. So Captain Harewood, I want you to share with us what is the CDM policy and why is it important to DEM?
Good morning, panelists. Good morning, moderator. Thanks for having me here. Permit me to provide a little bit of context.
You can put the switch on the mic.
Thank you. So good morning again, moderator, panelists, fellow panelists, participants online, and those in the hall. Permit me to provide a little bit of context. So the Caribbean region is known to be the second most hazard-prone region in the world. We need to know that. And Barbados is exposed, therefore, to, and we know there's a range of natural and anthropogenic hazards, man-made hazards, which include hydrometeorological, you talk about hurricanes, floods, storm surge, etc., landslides. And these are exacerbated by climate change, by the climate change phenomena. And then we have those geological hazards, earthquakes, tsunamis, landslides, etc. And as Simon just mentioned, we know that we can also be impacted by volcanic eruptions. So with these, and actually, given the significant developments that we have had over the years, in the post-independence period, we've also seen an increase in our vulnerability to man-made hazards, such as transportation accidents, oil spills, chemical incidents or accidents. And other man-made hazards, for example, also arise from the metaphorical shrinking of the globe, where things like epidemics, and now we're concerned about cyber attacks and terrorism. Unfortunately, these issues increasingly transcend distance and traditional boundaries and expose Barbados or the Barbadian population to new risks, which were previously not highlighted as significant hazard threats. This high degree of hazard exposure is accompanied by high levels of vulnerability, which arises from our physical and socio-economic factors. These factors, which present the risk of reversing the social and economic gains we've had over the last half century, include things like environmental degradation. A large portion of the population actually live close to the sea, critical infrastructure, et cetera, is in the coastal zone, limited human and financial resources, some impacts of poverty, a lack of knowledge about disaster risk among the population, and cultural attitudes towards our vulnerability. Therefore, managing hazard vulnerability and risk and building a hazard-resilient society becomes significantly important to managing the trajectory of continued sustainable development. As we recognize that Barbados' future sustainable development was dependent or is dependent on effective management of disaster risk and the creation of a more hazard-resilient community, in 2023, the government of Barbados adopted the Comprehensive Disaster Management Mandate, which will provide for management of all hazards, both natural and man-made in origin, through all phases of the disaster continuum, rather than just focusing on preparedness and response alone, and engaging all persons and sectors in the society with an intent to reduce hazard losses and damages, and create more resilient and safer societies. The impetus for this paradigm shift from just preparedness and response focus was driven by international and regional disaster risk reduction strategies, which were catalyzed by the International Decade for Natural Disaster Reduction. This came about because the UN General Assembly, recognizing the increase in natural hazards and disasters, in its resolution 42169 of December 11, 1987, declared that the 1990s would be the International Decade for Natural Disaster Reduction. In support of establishing the architecture and to implement the broad-based mandate of CDM, the government of Barbados also proclaimed the Emergency Management Act, Cap 168, back in 2006, which provided for the transitioning of the Central Emergency Relief Organization, or CERO as we knew it then, to the Disaster Management Organization now known as the Department of Emergency Management, with a broader mandate to encompass all the CDM requirements. And born out of these factors, and the intent of the DM and the National Emergency Management System was the Barbados Comprehensive Disaster Management Strategy and its associated country work program, which were developed as a strategy and an action plan for addressing hazards and disaster risks through the utilization of a comprehensive, inclusive, and results-focused approach. So the Barbados Comprehensive Disaster Management Policy 2022 was designed to ensure that there is a strategic direction to keeping people and making communities more resilient, keeping people safe, and making communities more resilient to the general hazards and climate-related risks and impacts. The CDM policy is extremely important to the DM as it seeks to provide the supported governance and accountability arrangements which would guide the development and mainstreaming of disaster management-related programs in all government departments, ministries, statutory bodies, community-based organizations, the private sector, non-governmental organizations, faith-based organizations, general communities, and individuals, all in an effort to reduce hazard-related losses and damages, build safer communities, more resilient people, and a protected environment, a stable economy, and a stable society, and a sustainable economy.
All right. Well, thank you so much, Captain Harewood, with regards to the importance of CDM, Comprehensive Disaster Management, and of course to our mandate with DEM. Remember that we are trying our best to ensure that disaster risk reduction permeates all sectors and all levels of society. That is not just the responsibility of a government department, namely the Department of Emergency Management, but our aim is to ensure that all levels and all sectors of society understand their role within their ministries and departments, even when we consider the work of the Barbados like Empower. to ensure that in our response and recovery efforts, all persons are involved to assist in making sure that Barbados can resume as normal after the impact of a major hazard. So thank you, Captain Harewood. I have a question for you two as well, the lovely Marlon Rice-Bowen. So as it relates to BARP, I wanted to ask you, how is BARP assisting its membership to become more resilient in the face of multiple hazards?
Thank you very much, Mr. Moderator, members of the panel, members of the media team, of course, our guests in the audience and guests online. There are no bad questions. This is a good question. But before I answer that, I just want to zero in where it's important that we focus on building resistance in seniors.
Yeah, resilience,
We recognize that seniors are more vulnerable. And when we think of the senior population, you don't think of only those of us who can move, but there are some who are differently able. There are seniors who are living in isolation. There are seniors who don't have access to any form of media. So it's really important that we start to build the resistance right now, because when the disaster strikes, it's too late. So, and then the other thing that's important that we have also recognized is that there are seniors, of course, with health concerns. And on top of that, you have seniors who firmly believe that the master will take care. And he does. He does. We will never question that. But he also helps those who help themselves. So it's to get them into that mindset that this situation is dangerous and you must leave. But they will tell you, I've been here for X amount of years. So it is about challenging that mindset that we have to do some deep diving. Now, as it relates to your question, what BARP is doing, we conduct our sensitization sessions via our website, social media, and email blasts. Of course, we collect all of the information from the DEM as well. And we also speak to our members via our Zoom sessions. On our Zoom platform, we can accommodate 1,000 persons. And persons will say, BARP and Zoom? Yes, our BARP members are tech savvy. They are. So that is how we communicate with them. And even in situations like during the hurricane season, we communicate with them via our Facebook channels, via
social media,
WhatsApp. So there are always links open, but with the links as well, we link to you. So whatever we get from the recognized source, we share with our members. What we want to do, though, as we look at the face of the multiple hazards, we want to, and I spoke to Simon about this before, just now again, we want to deepen that relationship with DEM.
Yes.
We want for them to hear it from you as well. Hearing it from us second is okay, but when the voice of Captain Harewood, when the voice of Simon, when the voice of my dear friend Brooks, and other players in this field, when they come to the fore and address our membership, then they realize that this is serious business.
Yes.
So as I said, we are doing our part, and we do as much as we can, but we recognize that we need to deepen the work, and we can only deepen that work through forging relationships with the relevant NGOs that look after disaster management.
Thank you so much, Marilyn. It's so true. It's about partnership and collaboration, and we want to be able to continue to include seniors in all of our emergency planning and disaster planning, because obviously, if they're considered to be a vulnerable group, they would have special needs. So even in terms of our warning messaging, we have persons who might be blind, persons who may be deaf. How are we going to be able to inform them and to warn them? Those persons who might be incapacitated or unable to move without assistance, they have to be included in emergency planning. So I thank you for your contribution. So we want to go to the community level. And Mr. Brooks, I have a question here for you. As we know, you have been involved with the district emergency organizations for a number of years. My question to you is why are DEOs important to community resilience?
Good morning to all. I would like to start by answering that question by defining community and resilience, because I think it is important that you have a correlation between the two. And if community is defined by a centralized area or locality in which the body of inhabitants are gathered in a group, we're speaking about a community of individuals at a geographical location. And if you are to define the word resilience, that is the capacity of the same community to withstand and to recover from impact. And therefore, the district emergency organizations across the country, since they are community-based, it gives them the opportunity, once they are functioning at the levels at which the department is seeking, to identify those areas and hazards. As this month we are concentrating on coastal hazards, but we know that St. Thomas and St. George doesn't have a coast. But it still means that the individual persons are mandated to go into the various community and identify those vulnerabilities, those hazards, and also those persons who are vulnerable, whether it be vulnerable persons, vulnerable communities, or vulnerable locations, so that once you are armed with that information beforehand, you are more likely to develop a response plan that in the event if that area is impacted. And that is primarily the significant importance of the district emergency organizations to this country. And I think that we have, obviously they are voluntary, as Marlon and I was discussing before this meeting started. Voluntary is not a word a lot of people like to hear in these days, because what is it for me? But my take over the last 22 years being involved in the emergency portfolio here in the country is that volunteerism is an opportunity for those persons to give back what they have learned. And also, no government of the day will ever be able to give you everything that you want at the time that you need it most. So in terms of community and building the level of resilience that is required, I've always stated that just as we have coined the phrase, tourism is everyone's business, I think the time has come that disaster management now has to become everyone's business, because the level of resilience is based on your capacity to build back. And don't build back at the same level that you had before, but to build back better. And it means that persons now have to start taking ownership of their disaster management concerns, recognizing that Barbados has developed to some extent, but any hazard like what we had with Beryl, which was 150 miles southeast of Barbados, could you imagine if that had impacted us directly? So we must seek to maintain and appreciate what we have, and seek to do what is required to maintain what we have, so that the country will have that level of resilience. And resilience starts in the home. As I said, when you define a community, a number of homes make a community. And the country's resilience is based on the individual contribution, the community contribution, and coming together. That is how the country builds the level of resilience to the various hazards that is likely to impact us from time to time.
Thank you so much for your contribution, Mr. Brooks. And you really did discuss the whole importance about community resilience. And community resilience, when we reflect on recovery efforts and the fact that across the world, that's always a challenge. You will find that developed countries are a lot faster and a lot more intentional in the recovery phase of the disaster management cycle, while developing countries, sadly, when it comes to the recovery efforts, are not as intentional. You get buildings that might be rebuilt, but not at the same standard sometimes, or even able to withstand hurricanes or other events as robust as the buildings before. And that has a lot to do with political will. It has a lot to do with finding the relevant developmental partners to assist you with getting the funding. We've seen already across the world that some US organizations who would have been major players in providing funding, and not just funding, but technical support, right now have been asked to stand down. So the challenge now is for developing countries, and even when we look at Barbados and our work when we consider our district emergency organizations and the fact that Barbados has a model that works and other Caribbean islands try to copy what we have in terms of the organization of communities, it is imperative that we find other donor agencies and other partnerships to allow us to carry out our mandate at the community level. So we go back to Captain Harewood. My question for you, Captain Harewood, your second question for this morning is, what has DEM been doing to improve community resilience in Barbados? You spoke earlier about the CDM policy and the fact that it's a multi-sectoral, multi-hazard approach to disaster management. But what is DEM doing to improve community resilience in Barbados?
Thanks for that question, Simon. Very good question again. So you just again mentioned the CDM policy. So the tenets of this policy are operationalized through our we call the Barbados Country Work Program, it's CDM Work Program, which is a results-based multi-year program developed with our partners in the National Emergency Management System. This program identifies priority areas for action, which are intended to increase hazard resilience by strengthening national and community systems and processes for emergency and disaster risk management. These priority areas, for example, are articulated as robust and well-resourced government systems, disaster mitigation supported by risk analysis, which reduces risk to people and infrastructure. So we need to know what we are susceptible to before we can determine how best to treat to it. Operational readiness at the national, sector, and community levels. CDM being mainstreamed and led by key sectors. Community resilience enhanced for the most vulnerable, with gender concerns addressed at all stages and levels as well. Again, the overarching aim of CDM is to reduce those losses and damages attributed to severe hazard impacts and encourage resilient and safer societies. This therefore provides the imperative for DM's capacity building initiatives at the community level, noting that communities are the nucleus of any society. We all go back to a community when we leave work. Wherever we leave during the day, we go back to a community.
That's correct.
And if the community is impacted, then the entire society is impacted. And this is meant to have a more hazard-resilient community system where resilience is the ability of a system, community, or society exposed to hazards to resist, absorb, accommodate, and recover from the effects of a hazard in a timely and efficient manner. Resilience also connotes being able to bounce forward quickly in a manner that reduces susceptibility. Therefore, you're impacted by a system, and you could be able, when you recover from that system, you should be better off than you were before the impact. CDM also ensures, or we also ensure that lives and livelihoods are protected and assets safeguarded. In that context, resilience also includes mitigation to minimize the impact of a hazard, and it embodies an ability to respond to the hazards that threaten Barbados. So not only do we need to identify what the hazards are, but we need to make sure that we can put systems in place to mitigate them, respond to them, and recover effectively from them. Therefore, in our effort to continually build community capacity in order to strengthen resilience, the DM is seeking to continually strengthen the district emergency organization, the DO mechanism, with community preparedness interventions, which include, for example, emergency operations training and the establishment of satellite emergency operations centers in the 5 district emergency organization zones, increasing the complement of community bins in those zones, continuing to support the district emergency organization training program, which includes chainsaw training, first aid, shelter management, fire safety, damage assessment, needs analysis, tarpaulin application training, and community profiling, just to name a few. We're also implementing the multi-hazard early warning system, or the MUSE, and the early warning for all initiatives. So the early warning for all initiative is an initiative of the UN Secretary General, which aims to spearhead actions to ensure every person on Earth is protected by early warning systems by 2027. Under this umbrella of early warning for all, Barbados has sought to strengthen its national early warning systems through a multi-hazard early warning, or MUSE project. And the Cabinet of Barbados has approved the MUSE policy back in 2022. So learn on MUSE policy, it seeks to ensure that persons were adequately prepared to respond to the impacts of climate change through the provision of guidance on the principles and processes that inform the design, implementation, management, monitoring, and evaluation of early warning systems in Barbados. We also continue to engage in the hurricane strap installation project, in which we are working with the Ministry of Home Affairs and Information to install hurricane straps on the most vulnerable houses in Barbados, which meet the criteria. And we continue our public-private sector disaster risk management orientation and contingency planning sessions. And also we have school engagements, non-governmental organization engagements, and I've just added here, we will continue to increase our support to the BARP, Barbados Association of Retired Persons, and any organization requiring our assistance. Thank you.
Thank you so much, Captain Harewood. That's quite comprehensive at the policy level, because one of the things you would recognize with disaster management, it needs the policy, because you can't mandate employers, schools, or persons in the private and public sector to do anything unless there is policy. So a big part of what DEM does includes advising the government of Barbados through the Ministry of Home Affairs to have policies that would, of course, increase the importance of disaster risk reduction and community preparedness. So having the representative here from the DEOs, Mr. Selwyn Brooks, he would be able to testify of the collaboration of DEM with other stakeholders to assist the district emergency organizations in becoming ready at the community level. So we need that volunteer community base to assist or advance the cause of disaster risk reduction at the community level. As I always tell people, DEM is a management agency. We are not a response agency. Our responders, of course, would be the BDF, the Barbados Fire Service, the Barbados Police Service, and so on. Those are the persons who are on the front line who would initially assist or respond to any major incident. We had up to yesterday a mass casualty incident, a vehicular accident. So those are the kind of things that our emergency services will be involved in. Now, when it comes to at the national level, when the Prime Minister declares that the country will be shut down, we are closing the country down because of the impact of a hurricane, we become very operational when it relates to the National Emergency Operations Center, where all of our stakeholders, including the Barbados Light and Power and other utility companies, including the Ministry of Transport and Works, Ministry of Agriculture, the Ministry of Tourism, they join us at the National Emergency Operations Center then to advise on strategy to deal with that particular hazard. And we saw all of this happening years ago. Recently in our paper, we saw that the families of the victims of the Archcock tragedy, years later, were still trying to seek some kind of compensation for the loss of the family. So all of those kind of things DEM is involved in. And we, of course, are learning to become more resilient, even with our partners, the Coastal Zone Management Unit, responsible for mapping the coastline of Barbados, letting us know the threats and what would happen if there is inundation by waves, how far in tsunami waves, or how far in any kind of coastal flooding would impact Barbados, which is important information for business and also the Ministry of Housing, who will be building communities or housing areas in those areas. So there's a lot that is happening at the national level as well at the community level. But my question to you, Marilyn, lovely Marilyn, I was saying to you earlier, you're the rose between the two thorns.
True.
But
I wouldn't dispute. That's not up to dispute at all. Is it?
so you confirm. My question is, when you consider disaster management now, in your honest opinion, do you believe that the needs of seniors are really, number one, embraced at the level of disaster planning? Do we consider the needs of the seniors in our communities during the impact of a hazard, based on your experience?
Okay. Based on my experience, I would say that we believe so, but we also feel that more can be done.
Yes.
And what we ought to do is to try to preempt everything, because what happens is that when a disaster is pending, there's a focus on seniors, but you need to know where they are.
Mm-hmm.
You need to know what condition they're in. Mm-hmm. You also need to know there are times that a senior might live in St. Michael but might have children that live in St. Lucie, and that person might decide to go elsewhere. We can't plan for seniors when the disaster is at our doorsteps. We need to be communicating with seniors as we speak, because you're dealing with a different, I mean, they have paid their debt to society. Some of them might not be as sharp mentally as others, but let's plan ahead. Seniors like to plan ahead. You can't, I mean, they're not as spontaneous as younger people. So you need to let them know things like, which is so important. Medication. Can they stockpile medication? Because you might have somebody who is a diabetic or any NCD, and a disaster during hurricane season. Can they get an extra fill of their medication?
That's right.
So right now, I don't know, but that's something we need to know, because if we know, we can say to them, when the hurricane season comes around, always make sure you have 1 extra month of medication.
True.
That's important. That's so important. Things like their documents. Where are your documents? You know, people say, man, tell them that when the time comes. But as we speak this morning, we are saying to seniors to get those waterproof containers that, you know, the children and the grandchildren wear around the neck when they go to the beach, and get your documents in there. Or even so, even if you're keeping them, let somebody know where your documents are. But the importance for me and for us at BAR is preparation. And preparation, as I want to reiterate, preparation cannot start when the disaster is right there. And I was speaking casually to Robert this morning prior to the discussion. I would say, you know, with a hurricane, with landslides, with flooding, there's an element of preparation. There's a fellow called an earthquake that we don't know when that will come. So that is why it is so important that disaster planning starts and is intensified for seniors as we speak, so that if anything happens, as I was being very honest, it's late, you know? And I said to Robert, I don't even know what to do in the case of an earthquake. All my tables are glass.
That's right.
So they said, you know, it's often said, go under a table. So I'm supposed to know, but I don't really know. What, should I run outside in the road? Should I stand in the doorway? You know, I can't go under the bed. The beds are divans. These are the kind of conversations we want
True.
to have with our seniors. We want to have that conversation with them so that they are prepared. I am prepared for hurricane, all the other fellows, because we will know they're coming. As I speak here this morning, I'm not afraid, I'm not ashamed to say that I am not prepared for an earthquake. And if I'm not prepared for an earthquake, it'd be honest, you know, you could assume that my membership isn't either. And I want my membership to be prepared, so therefore, let's start the talk now.
All right. Thank you so much for your passion. That's why I love to have Marilyn on a panel. Marilyn gives it straight. She shoots from the hip, as the people say. But it's true. We have to take more consideration to include our seniors in our disaster management planning at the community level and at the national level. And it is very important to have a list of the persons. Well, we have the vulnerable persons list that come from various organizations. Even internally within DEM, we're working on our vulnerable persons list. I'm sure there's a vulnerable persons list with the ministry, with the welfare department and so on. So it is important for us to know where these seniors are and to ascertain the level of assistance that they would need prior to the impact of a hazard. So now we move on to Mr. Brooks. Mr. Brooks, I have a question for you. In terms of community resilience, we know that the DEOs are active, but I wanted to ask you, how have the DEOs assisted in improving community resilience, especially like during your tenure? What are some of the achievements you would say of the district emergency organizations in terms of improving community resilience?
If I can follow on from what Marlon has just indicated, the district emergency organizations are mandated, well, I use the word loosely mandate, are requested that in their sojourn in the various communities to identify those elderly persons and the vulnerable persons and the level of vulnerability, whether it be medical, whether it be physical, whether it be mobility challenges, whether it be the state of their homes or whatever. And having that information beforehand. A hurricane is the only hazard that gives us the opportunity to see it coming. So when we look at earthquake or we look at tsunami activity, especially a tsunami, you do not have that element of time to prepare before. But having that information beforehand and sharing it with the relevant agencies, that will give not only the Department of Emergency Management, but all of the response agencies an opportunity to know exactly where they are, what is the level of capacity, and what is required to offer some level of response to them. So the district emergency organizations, in my mind, is one of the most critical components of the country's disaster mechanism in terms of identifying such persons. But don't only look at the elderly. I mean, the elderly are most vulnerable. But vulnerability doesn't come with age, because there are some persons who are able-bodied like me. I just celebrated my 21st birthday last week. And
Times three?
Oh, yes. So it means that we now have to look at vulnerability and not only look in terms of age, color, race, creed, or whatever, but look at an in-depth analysis as what is within our various communities. And I'm pleased to say that the DOs over the years have been starting to do this. A vulnerable list is not something that is stagnant, because today I'm okay, tomorrow I can easily become on that vulnerable person's list. And having that level of rapport, Marlene, with the vulnerable persons, because elderly persons have acquired whatever they have acquired over a period of time, and it is important to them. And they're not going to be so prone to leave it to go anywhere. And in some cases, we know that the elderly people are no longer treated in a way when some of us were much younger. So it means that we now have to do things differently. We need to engage the younger people to understand that these vulnerable persons who have left a legacy and have provided for the comforts that they are now currently enjoying, because they too, I too will become vulnerable at some particular point in time. So therefore, that type of information and sharing has to be continuous. Also, in terms of at the community level, you would find that vulnerability comes in several areas, whether it be mobility challenges, persons who have cardiac conditions, persons who have respiratory conditions. You know, it's amazing, Simon, that I was listening to the radio program 2 days ago, and we had a fire as far as Bushy Park. And the moderator was saying, I think there has to be some problem. I don't see how a fire in Bushy Park can affect Ellerslie School. But it means that they don't understand, and they need to be informed that with the fire, and the smoke goes up in the air, and the wind takes it down, it's going to come back down once the wind speed reduces. So that is the type of information that we need to share a little bit more with persons. And tsunami, I want to touch a bit on that. Where the Department of Emergency Management, in collaboration with the Coastal Zone, is now steadfastly moving to increase the level of tsunami awareness around Barbados. It is something that is relatively new to Barbadians, and amazingly, some people really don't care. Because a person who told me, when the tsunami comes, I will deal with that. And therefore, and you won't believe where he lives. He lives on the first grain of sand that the beach washes away. So I think that we have now to create the mechanism in which, when we share the information, to let people know how they can be impacted, how they can lose their lives and their properties and their loved ones. And you can't stop the tsunami from coming. You can't stop the earthquake, but we can most certainly prepare for it so that when it comes, we are better prepared to cope with it and more likely to save lives and to save some level of destruction, because you know what you need to do. You need to build different locations, and you need to take these things into consideration. So it is an ongoing exercise that is so desperately needed. And it goes back to the point which I made in the former question. You know, it's mandated that everybody must understand that they have a critical role to play in the sustainability of themselves, their families, and by extension, the country.
That's right. Thank you so much, Mr. Brooks. I think that the greater emphasis within our communities that's spearheaded by DEM, of course, would be the training and the equipping of the DEO volunteers. Obviously, the volunteers for example, the St. Joseph DEO are members of the community in St. Joseph. So the added benefit of having persons who live or reside in the area or the particular constituency that DEO is in, as well as being trained, is a multiplier effect because persons in the DEO would volunteer and would encourage persons from within their community to join the DEO to be ready in case any kind of major crisis occurs. So we want to thank you, Mr. Brooks. We want to get back to Captain Harewood. Your final question from me at this point. But before we get to your question, we had a question online from one of our viewers. She was asking, I believe, where you can find the CDM policy. Well, the good thing is that on our DEM website, www.dem.gov.bb, if you go on our website and you do a brief search for CDM policy, you will see the CDM policy outlined in our website. So you can check it out. Those of you who are, of course, following online, you can visit our website and also our social media pages to get more information, not only about DEM and the various policies, but also for our month of activities happening for March. So Captain Harewood, your question is, what suggestions would you offer to improve community resilience in Barbados from your position as Deputy Director at DEM?
So thanks again for the question, Simon. And I want to say before I go to that question that the other two panelists creates a very good segue into answering this question in particular, because resilience for Barbados will require some sort of transformation. I think Mr. Brooks is one that mentioned that after an impact, so we have vulnerability is time and space dependent. So there are a number of persons who you may identify as vulnerable before an impact, but certainly post-impact, those people who may not have been considered vulnerable may not be vulnerable themselves, where one could lose your entire possessions, you can lose everything that you thought that you would, I don't want to be morbid, but live and die with. And I want to go to experience in one of the, so I've had the experience to be deployed across the region, so I've been able to see a number of impacts and how people respond to impacts. And I know sometimes what we don't recognize is that, and this happens sometimes with the elderly, you've lived your life, you've had what is called your nest egg and everything, and the system comes and takes everything away. There's no starting over. So you may not be vulnerable before that, but now you are because you have nothing. And this is a reality that sometimes we don't necessarily see because Barbados has been blessed so far that they've not been severely impacted, and let's continue to pray for that. So we need to recognize that there are a number of situations where we all can be vulnerable after an impact. So to say that this transformation, I believe, will involve engaging communities directly, meeting persons where they are, getting into the communities, working with district organizations, talking to people on the ground, understanding the issues, trying to work through some of those issues, et cetera. And this in order to ensure that disaster management knowledge can be shared and vulnerability addressed. Therefore, in our efforts to improve community resilience in Barbados, we intend to work with the communities to ensure, for example, that communities know the hazards and risks for which they are vulnerable or susceptible, those geological hazards we talked about, earthquakes and the secondary effects. Because again, we talk about earthquakes, but the earth shakes. What happens when the earth shakes? There are several secondary impacts after that. There are fires, there's water flooding, there's a whole number of things. You end up with again, I don't want to be morbid, but rats and stuff in the water, and you end up with people getting injured when they're wading through water from whatever's in there that you can't see. And I will leave that one right there. So you can lay down and when you sleep and think about it. Don't get nightmares, but think about it. Think about the things that can go wrong after an impact, a severe impact. So the hazard is the hazard, but the hazard brings impact. So for example, we know Hurricane Beryl was a hurricane. What was Hurricane Beryl? What did it do to us? So the hurricane itself didn't cause challenges in the fisheries complex. It was the high sea swells, which was part of the hurricane. Because we understand hurricanes are known by wind speed. So we categorize hurricanes by wind speed, category 1 to 5. Now 5 enhanced, even 6, maybe even 7. But we often don't think about what does that mean. So apart from roofs being impacted, what about flooding? What about precipitation? What about pressure? And again, and I just want a little segue here because we've seen in the region too where persons' houses, wall houses, cement roofs, shutters and everything are on, but the house was destroyed. Because from the time the wind gets between or in that building, gets any space between that shutter and gets into the building, the only place for the wind to go is back out somewhere, either through the roof or back to that same window. So although the shutters are designed to keep debris out, if they're not installed correctly, if there's any space between those shutters where the wind can get in, and this is when you have severe wind, then there are other challenges that sometimes we don't recognize, right? So we want to continue working with the communities to inform about these types of hazards, what they can bring, some of the secondary impacts, because as I said, we don't often think about those secondary impacts. The managed hazard, things that we create for ourselves. Mass casualty, in the incidents, like Simon noted a couple of days ago, we had a mass casualty incident. Fires has materials, etc. And further to the identification of those vulnerabilities, communities should create basic individual, family, and community plans. We need to know what to do in the event of a situation. Now, the plan is a guide, because we plan for what we know. And when we know something further, we adjust the plan to treat to what we just realized. So the plan is a guide. And these plans will speak to how we mitigate the hazard. Do we build additional walls? And remember, if you build a wall to keep the water out, make sure the water doesn't go to the neighbor instead, etc. So a lot of things we need to talk about respect to those hazard plans. We talk about mitigation, preparedness, response, and even basic recovery plans for the communities as well. Residents should attend, when possible, this emergency organization meetings. Go to the meeting. You don't necessarily have to join the deal, but go to the meeting. They're advertised, and understand who in your community can assist you, what their vulnerabilities are, and how you could also support in the event of a hazard impact. So you don't necessarily need to be there all the time. Most people don't want to join things because they have so many other things, but there's certain things that we need to be aware of. So if you can go to deal meetings, put your name down, say, I have a backhoe, I have this, I have that, I have these types of skills. If you need me, call upon me. And that will help build community resilience. Also, a person should consider volunteering the services to the DM, for example, as well, not just the DOs, but to the DM as well. We also take note of those artisans that serve in the community, that they can be used in the post-impact period. And they should has a preparedness, I think Bob Marley said, a liberty. Live it. Understand that we are surrounded by hazards every day. It's not just the hurricane season. People always ask me if we're prepared for the hurricane season. And they ask them the same question, are you prepared? Because if you're not prepared, I can't be prepared. Because we depend on you. We're just a department. We depend on the community to be prepared for these types of impacts. I also want to say that as part of the multi-hazard early warning system, and I want to thank Jair and the team from the UN DRR, Disaster Risk Reduction Center, for supporting this intervention, very timely and important intervention, that and there are 5 pillars. Another pillar 1, which speaks to disaster risk knowledge, and pillar 4, which speaks to preparedness and response capabilities. We at the DM are proposing to facilitate what we call DM in the community, a type of intervention which will provide, in collaboration with district organization, provide forum for church groups, service clubs, and associations, etc., within the communities across Barbados to be engaged by the DM and its partners in the National Emergency Management System, where we can introduce them to diverse disaster management concepts, considerations, etc. And this is all in an effort to continue to build community resilience, capacity building, noting that early warning and early action saves lives. Thank you.
All right, thank you so much, Captain Herwood, in terms of what DEM is doing to improve community resilience and what suggestions could be offered. So we thank you for your contribution, and we move on to Marilyn. So once again, my question is similar to you. What suggestions would you offer to improve community resilience for seniors in Barbados?
Thank you, Senator. Before I answer that, though, I want to give two tips. I think I did it last year, but never have too much information.
Bring the mic closer
Because
to
I've professionally,
Turn up, Press it.
you turn up.
Yes.
Because I've worn, because I professionally wore another hat, it's difficult to divorce myself from that. What you should do as we speak, maybe tonight, go through your home room by room and take photos of your house as it is. When disaster strikes, and Captain Hayward could support me, and you don't know what was living room, what was dining room. If you had, because the dining room chair ended up in the kitchen on top of the stove. So if you need to take those pictures, so when you are filing your claims, etc., they could see what the home looked like before, because nobody knows what that house looked like before. And the other tip, before I answer Simon's question, I'm going to do that right now, is that people have a habit that once November 30th comes,
That's it.
they go through their pantry and eat all of the food they had stored for the hurricane
dear.
season. But you should view those food supplies as emergency
reserves.
supplies. It's not only for hurricane, because as we talked about the earthquake, the tsunamis, anything can happen. So once you have allocated space in your pantry for emergency supplies, make sure you always have those emergency supplies. Do not keep a party post the hurricane season and eat out all of those supplies. You don't know if you're going to need them. That is my tip, your answer to your question.
Yes, ma'am.
One of the greatest challenges to government's efforts to increase national resilience to disasters is the dearth of volunteers at the community level. We recognize that. We at BART, we have in excess of 20,000 members, and most of them are retired and capable. So we stand ready to fill the void. And this is not lyrics, this is a statement of fact. Our members, we have members who've worked at every different levels of society, and they are willing to help. We also agree with the 2022 Comprehensive Disaster Management Policy for Barbados, page 21, section which proposed that sustainable financing for delivering the community resilience agenda by community-based organizations must be a priority. With the assistance of the DEM, we need to, if it's not being done, to create a senior emergency registry.
Senior emergency registry.
Yes,
All right.
and
All
it
right.
has to be done at the community level. We can't go national unless you've done it at the community level, so that the district officer knows where the seniors are. Not only that, but sometimes seniors go away for 6 months, 8 months, and the houses are closed. So that there's somebody in the community who say, not that house, she's overseas. Not that one, she's gone, she's left home. So that you won't be wasting time. Because, in recovery efforts, you could waste time trying to break in a house and thing, and then nobody is there. So there's a need to communicate. And this registry can be manned by volunteers, even drawn from BARP as well. We are willing to assist.
All right.
Right? And information could be collected via a simple registration form available online or in paper form. And we can use BARP as a center for collecting some of the information. You need to set up stations, island-wide, supermarkets, any little space, but you need to, and we need to get going now, right? And community centers, churches are an excellent source of collecting information.
True.
And the healthcare centers and as I said, supermarkets. And it's just basic information, name, age, contact details, address, emergency contact, medical conditions, very important, special needs during evacuation, and utility information, because there are times during disasters that we forget or we are not aware that somebody has a piece of medical equipment that needs power. So that information must be recorded. You know,
Yes.
so that is important. So Barb and the DEM, we could agree on a technology instructor to include GPS mapping, ensure data protection and privacy, integrate with health services. And to sum it all up, the establishment of community-based, I'm hearing that common thread coming through all the presentations today, that there is a need for the community-based assistance. And to be able to, we need to work with the Barbados Police Service, re-establish or strengthen neighborhood watches. I recognize that neighborhood watches are in the quote-unquote developed neighborhoods. But are there neighborhood watches in our city communities?
Of course, for sure.
You know, they don't, are they? We know them, in all
Not
the
formally,
parks
true.
and the terraces and the heights.
They have a formal one.
Yeah, but if you're serious about neighborhood watches should be across Barbados, right? And establish zone leaders, train leaders for the zone. But I would also want to end by reaffirming our commitment to assist, right? And Simon, I'm saying it here, and we'll say it again.
Yes.
We're not going to sit and wait for an invitation. We will come knocking on your doors and say, we want help.
For sure.
Right? Because if we can help, there's 20,000 members that will be able to help. That is a big chunk of a society that you would want.
Oh, yes.
Right? And in closing, from my end with your question, I realize you spoke about tsunami awareness in the South. I want you, please, sir, to add Barb's headquarters at Moorview House, Hastings,
Yes.
for training, because we are right on the South Coast. We could see and smell the ocean. So we would want to be part of
Evacuation
that.
procedures, yes, definitely.
Please.
Thank you so much. Thank you
Most
so much,
welcome.
Marilyn. As usual, you give us a lot of food for thought. And it's quite interesting that you mentioned about the tsunami awareness and training, because there is a daycare, a nursery school, the Incredibles Academy. We did some work with them recently. So obviously we can come across, because I know that Barp is there, then you have Palmerine, then you have the little nursery, right, Incredibles Daycare Academy. We did some work with them. So we are hoping to get into that area. So definitely we will be doing some work. Thank you so much for your contribution as usual. And now we're on to you, Mr. Brooks. Your final question is similar. What suggestions would you offer to improve DEO operations in communities? What are some of the things you think that DEOs need to be more effective in the community? And also, with regards to your work and with the DEOs, how do you think you are being able to be of service to your communities?
I will start off. Resources is one thing for sure. When we speak about volunteerism, a lot of the DO's members do work, and sometimes accessibility to the resources that are required might be limited. However, it is still the onus of the department and the government of the day to see how much additional resources that they can make available to the DOs. And that's, I will start out by saying that. Secondly, there needs to be a better relationship between the emergency personnel and the community. And let me define that. Everybody believes it's the fire department's responsibility for this. It is the DM responsibility to do this. It's the BDF responsibility. You get the point which I'm making? It is everybody else's responsibility to do what they expect. But how do we get across to the individual? What is your responsibility? What is your commitment in terms of understanding that you have to play a part? I picked up on Marlene's point, and I'm going to pick you up on that, because we need to have a little bit more persons involved at the district emergency organization level. I know that BARP would be certain persons. I'm a member of BARP as well, okay? Sure. Yeah. And, so I just moved I've just moved from 21 years old. I think the age limit now you can join at 40. But even although the majority of membership of BART may be over 40, it does not mean that you have amassed a certain level of experience and knowledge from your vocation when you were actively involved. And I think the DOs and the country should be able to benefit from that level of knowledge and expertise. So I would like you to encourage, I will give you all of the contact numbers for the district mercy organizations so that you can advertise on our behalf to see how we can mobilize some of those persons within your membership to join the DOs. And tell them it is a worthwhile opportunity. There's no money to be had, but we will benefit from your experience and your knowledge. Added to that, the business community too has to play a more meaningful role. I know from time to time, just like in the teachers, what else you want a teacher to do? You're going to ask the question, what else you want the business community to do? But the business, every business in Barbados nestles within a community. And what can happen at that business can affect the community. And by virtue of what happens in the houses in the community can also affect the business. So there needs to be a greater synergy between community and business because we need each other. And the district emergency organizations, in collaboration with the Department of Emergency Management, when we are doing our community profiling, and even 2025, we have just started a community resilience program of identifying not only the business houses and individuals, but more importantly, to get those members of the community and the same BART membership who would have some time that they can offer some assistance so that we identify the hazards, quantify the hazards and the risks associated with them, prioritize those hazards, and see how we can get that level of information and training to a wider community and also the business sector so that they will be better equipped to cope with what can happen. Too often we find, let's give for argument's sake, we had a fire in Cane Garden 2 weeks ago. It was a business that has oil. I mean, this is public knowledge. This is nothing that we can do. That oil ended up in the road. And even up to yesterday when they passed there was still remnants of the oil on the road. Whose responsibility is it to do or to extract that oil so it does not continue to purge onto the road? Is it the government's responsibility? So we need to have the business community to understand they too have certain responsibilities because that is going to affect the community. We also have to recognize that you made a very valid point, and ironically, since we are in enlightened power, there is an increasing number of persons who their monitoring equipment is dependent on power. And how can that level of regeneration of power be made more affordable? Because the rich persons in the room who may be able to afford the GPS, and that only has a certain lifespan. But we're talking about continuous, especially persons who are in cardiac or respiratory equipment that they need to have, because you can't tell the person electricity's gone off and my oxygen concentrator, which needs power to run. You can't say, oh, you hold on for 10 minutes. Because when you come back, you're going to call the undertaker. So these are things that we need to have greater dialogue and affordability, because if he's speaking about resilience, that component of our community who depend on life-saving equipment that is powered, we need to see how we can make it more affordable, because it is no longer the rich persons who are using this type of equipment. Oxygen concentrators are something that is becoming very common in the average day community. So in closing, to answer your question, Simon, I think there's always a lot more that can be done. And I would like to take this opportunity to extend further invitations to the general public that when we have our district emergency organization meetings, come on board, hear what the DOs are doing, share with what you can do to assist so that as a collective we can bring our resources, our knowledge, and our capacities together to offer that level of support at the community level, which will increase our community resilience across the board. But Marlene, I look forward to, I will definitely share the information with you. And
Wonderful.
ask your members to contact the department, contact myself, and let us see how we can get some more of you persons on board.
Thank you so much, Mr. Brooks, for your contribution. And I must say that I appreciate the level of dialogue we've had this morning. More importantly, our panelists really giving us in-depth answers and responses to questions. Because the topic today is empowering communities to take charge of their own resilience. So we had a select group that was represented here, considered to be vulnerable, being the seniors in our communities, represented by the Barbados Association of Retired Persons, which is the single largest organization that represents the needs and the interests of seniors in Barbados. And they're a vulnerable group. And the fact that they're interested in learning and also understanding that the partnerships with DEM and other NGO players is important for the resilience of our seniors in the community. We also appreciate the contribution of Captain Herwood, who was able to explain to us comprehensive disaster management and also what DEM has been doing over the number of years in terms of this advocating for policy with regards to the partnerships and synergies with regional organizations, as well as the standing committees that work within the national emergency management system. We thank Captain Herwood for his contribution in that regard. So we're hopeful that those of you who would have been watching our stream have a better understanding of the responsibility at the national level that was represented by Captain Herwood, at the community level that was represented by our consultant, Mr. Salman Brooks, and also that special vulnerable group in our society, I mean the seniors. And we recognize that there is a greater need for synergies across all sectors in Barbados to ensure that the needs and the interests of everyone, especially the vulnerable groups in our society, are recognized and also accommodated. We recognize in Barbados that it may not always be a hurricane that may cause the damage or that may significantly disrupt our lives. We've had situations in the past where, because of ash, like I said, the ash fall, although we knew that the volcano erupted in St. Vincent, we did not anticipate that the ash fall would be so significant and would have been such a lingering problem in our society. Even up to today, there's still persons saying, I can't get the ash out of my house. I can't get the ash out of my business. So we need to be forearmed. You know, we need to be forewarned so that we can respond and be able to deal with these issues when they arise, because something as simple as ash can interrupt our society. The fact that we had a whole ash program of persons continually clearing the streets. I mean, every day they're going back out and you're seeing more ash, right? That is how significant a problem like that. Let's think about COVID as well, and the impact that COVID had, being what we would call a hazard, a medical hazard, in the sense that we had the whole COVID-19 pandemic and it was seriously impacting Barbados. The fact that Barbados was shut down in terms of operating virtually and not having actual services for months just shows you the impact of how a medical or infectious disease can shut down a whole country. Remember the airport? I would never forget passing by the airport. No planes on the tarmac, no cars in the airport. This is like you can go in and swing a cat, as they say. The airport car park was just empty. All because of COVID. So we know these are things that happen. And that's why we need to be ready, and that's why we need to know the various groups in our communities and the needs that they may have. When we consider the seniors, when we talk about young people, I think my biggest concern for young people during times of crisis is mental health. Believe it or not, I am most concerned about the mental health of young people during a crisis where there is no access to electricity, no access to internet, oh dear, no access to water or limited access to water, and the fact that you have to be confined to a particular space or geographical location. A lot of our young people suffered during COVID because of mental health issues. They can't go outside. They can't communicate as they would like. It was challenging. So can you imagine a major earthquake occurring in Barbados, and we are without electricity and internet for months? Not saying that our Barbados Light and Power would not be on the job to get our light and our energy back up. But obviously after a major earthquake, the poles are disrupted. Not only that, the substations might be impacted. It will take a while for services to come back online. And I think that's another message we want to tell the public, especially during hurricane season. We remind persons that, look, to preserve our networks and our utilities, sometimes you have to shut down early. I know that was the issue with the Barbados Water Authority, and persons were really upset last year. But to preserve their equipment and the quality of service that will be reinstated after the impact of a hazard, it is very important that we get the cooperation of the public. And that means then community resilience is a personal responsibility. So rather than saying, well, you know, the Water Authority said they will provide water to X time, no, you start to store your water in your containers, or you buy cases of bottled water to make sure that your liquid needs are met without having to rely on the Barbados Water Authority during a major hazard. And what about power? We always tell persons, of course, you need to have your rechargeable batteries and devices. You need to have your power banks topped up so that when your electricity is gone, you can still have power. But more importantly, we have a number of private sector players that offer the rental of small to large generators for homes. So if you need to get a generator, let's say that you do not want to part with all of your salt meat and your pork and your chicken, you know, you can get a generator that can power you. I know a person, like some shop owners do that. In my community, there was a shop owner, when the electricity went out, they had to rent some large generators to keep the meats, because at that level, at a commercial level, they need to have their meats. But for those of you who can probably wing it, you know the hurricane is coming, and you need to have power in your home, you can rent your generators. There are a number of private sector companies that allow you to rent your generators. So all of that being said, I want to thank our panel. I think they deserve a round of applause. We want to thank you. Clearly, this is the beginning of a lot more work that has to come. I know we have some members of the audience here. I want to give you the opportunity to ask any questions that you may have while we do our wrap-up. If you think of something, you can slip your hand in the air, and we will get a microphone to you. We want to thank those who would have been watching online for your contribution, for those who have been liking what would have been said by our facilitators. We have a question in the audience, so we're going to provide a mic for you. Let's go to Axe. Julia, you don't mind coming to? Let's hand this mic to one of our guests here in the front row with the glasses. Right, and that mic will stay in the audience, and this one will float between me and our panelists this morning.
Good morning, thank you. I actually have a kudos, a question, and a suggestion. Is that okay?
Well, that's wonderful. That's comprehensive.
So, I'll try not to make it too elongated, but my kudos, first of all, I represent an entity outside of Barbados that does programming in Barbados and Dominica. And we had a project called Information Saves Lives. And so we actually did some work with the DEM and particularly the DEOs, because we focus on community level interventions, and particularly vulnerable communities. And so I want to make special mention of St. Michael Northwest DEO, extremely efficient. They actually helped us to bring communities together, and not just the physical community of St. Michael Northwest, but the elderly. They were able to bring elderly out. They knew the people, as you said, there's some vulnerability assessment they did.
That's right.
Persons with disabilities, and we were able to hear from them about messaging in particular, because Information Saves Lives does speak about how is it we use information, how is it we use media and knowledge to work on community-based resilience. And so I want to say kudos to the DEO and DEM for that work. My question, though, is I, too, I'm a fan of BARP. I was, at one point in time, the administrator for the Seroptimus Village seniors. And my mother is actually 93 years old and in reasonable health. My question, however, is she's lived in a community all her life. She cannot come out, but she's never seen y'all. The DEOs do not walk around as they claim. And so I wonder, in a situation like that, obviously I kind of liaise with them for her, but for those persons who are alone, not just elderly, but alone, shut-ins, how do you suggest that they become connected with the information necessary to prepare and to respond to hazards?
I'll take a first go at that. I would admit that not all the DOs are functioning at a level that we would want to think that they could be operating at. But for those that are offering some level of community engagement, while that information is collected while they're doing their profiling, the DOs are expected or asked to keep in contact with persons at least twice a year. And why we say twice a year? Before the hurricane season and after the hurricane season. Because it is critical. It is critical for that level of assessment to be continuous, because a person's condition can change based on, and usually on a hurricane, persons who have hypertensive, those conditions significantly increases because of fear, not only a fear of the system, but fear of the potential damage that can come to them because they're no longer as agile as they were when they're much younger. But once those persons are identified, there's some level of expectation, and you have to couch my words very carefully because, you know, they are all volunteers, and sometimes you hear a person say, well, what else you want me to do? But if those persons have the kindness of their heart and they recognize that those persons need, and in closing, my experience has always been that when you interact with the elderly persons, sometimes they don't want you to leave. Why? Because it is about building trust. That is a critical thing. Building trust and acceptance, because business are usually very proud persons, and some persons are not so freely want to give information. But what they can trust, and they know that they can count on Marlon, and they can count on Simon, and they can count on Selvin or whatever, that when something is pending, that we would inform you so that you can seek assistance, whether from relatives or whatever, even a simple thing like going to a shelter. I always tell persons, don't go to the shelters unless it is absolutely necessary. If you can seek alternative accommodation with a friend or family, because in the shelter, the conditions don't always be as you would like them to be. So if you can give me that individual's name and number, I will endeavor to see how we can facilitate some level of visitation so that that person can feel a little bit more comfortable. So thank you very much.
Good morning again. Thanks for that. I don't want to age myself, but I want to say some years ago we did do work with the Sortenbus village. It was very encouraging. We generally intervene on invitation. Now, what we have not done is continue that relationship. But it just know here that we will have to continue that relationship because people leave, people go in. It was really heartening for me because I was there to listen to the elderly, listen to the stories, understand where they came from, what they brought to the society, etc. Things that we would never learn in a book, right? And to be able to assist those persons in basic emergency procedures and understanding what to do if this should happen, who they should call out to, etc., was very encouraging. So I made a note here that we will pursue. I don't know if we should call or they would call us, but I think we would just reach out to the Sortenbus village and any other home that requires our assistance. Please get in contact with us, and we will come out and do our best to ensure that you are in the program.
Thank you. And a quick suggestion on something, which I know we experience, but I find we haven't been talking about. I know it wasn't the focus for today, but I want to bring it up. So the entity in which I worked on Information Saves Lives is based in California. And y'all know what happened in California recently with the fires. Yep. So it don't matter, this vulnerability, rich, poor, it don't matter. These people lost a house, the schools, complete destruction. So I just want to say that. Secondly, I'm not 100% certain what was the trigger for that, if it was wind and heat. But one of the things we all know is that every year it is becoming hotter and hotter. And I see your partner there, USAID, was also a partner of mine, so sorry to see them go. But I was part of their very first extreme heat climate conference last year. That is something we need to pay attention to.
And
It is not, and drought. It is not a hazard like we know a hurricane is coming, but we know we get extreme temperatures just like France. We live in a tropical climate. And so seniors are saying, I don't feel good, my mother, I need water. You know, the construction workers are crying out. We crying out and we young, right? I like to run, I can't run. So I think we also need to pay attention and probably have some messaging, some research, I don't know, on extreme heat.
Yes,
because
I think we're taking note here, Nathan
Yeah.
and Julia. Yes, Julia is taking note.
Sorry, I know
Yes.
it's a bit long. Because
Go ahead.
the other thing I learned from y'all, just some terminology, we are in what? A polycrisis. It's not just about climate, it's health conditions
Well said.
being impacted
Well
by
said.
climate. So the old people getting swollen feet. My dog was vomiting last summer. When I checked with the vet, too hot.
Heat, overheating.
Okay? So I just want to suggest that it's something we pay more attention to. And I did hear that come next month, April, our temperatures going up. So we
It
all
is
going to
true.
be impacted. Okay?
Well-
but
well
thank you
said.
guys for
Thank
today.
you.
Thank you.
Thank you so much for your intervention. And it is true. It is true. Definitely DEM, when we convene meetings with the Health Services Committee as well, I think on the agenda we should be discussing the polycrisis and extreme heat. We already know that Barbados is a water scarce country, and we don't really understand the importance of drought and how it impacts us and our animals, our livestock. This is a conversation that we would have heard with the BAS president and others speaking about how the extreme temperatures affect poultry, affect the pork industry, and so on. So not only does it have implications for us as human beings, but also our various sectors, our various industries. So thank you for your contribution. We'll be looking to do some messaging to that regard. We have another question here from a representative from the UNDRR, Mr. Anwar Bash. Okay, we're going to let Captain Harewood respond first, and then we will go to Mr. Anwar.
So it's not really a response. I just want to add to it. Because when we talk about extreme heat, we know we are very susceptible, not dissimilar to what happened in California, but to bushfires in Barbados. And Queen's College, for example, closed early yesterday because of smoke. West Airsaw as well. And this, you're going to call all the schools for me now, right? So we know that we're impacted, the schools are impacted almost annually by these fires and the ash, et cetera, et cetera, et cetera. So one thing we need to always recognize then is that the areas around us, it might not be our land, need to be kept clear, you need to debush. So if you know that you live in an area where there's a lot of vegetation, dry vegetation, please reach out to the Ministry of Health, reach out to Public Works, reach out, because those areas need to be cleared. Don't worry, somebody would probably have to pay for it at some stage, but they could easily present challenges to homeowners, to the general public, for example. One of the things that we did a little survey with fire service recently, and one of the things that they always encourage is for you to, if you know you live in a property that is very close to bush, create that fire break between your property and where that bush is. So to give you a little chance from fire impacting you if that should happen. Right?
Thank you, Captain.
Okay.
Thank you, Captain. Good morning, everyone. My name is Anwar Baksh, UN Office for Disaster Risk Reduction. I'm also your neighbor of BAP. We're just up the street from you. I have one comment, actually. First of all, it will be remiss if we don't acknowledge and commend the efforts of the Department of Emergency Management in championing the cause for not only tsunami readiness or earthquake preparedness, but a multi-hazard perspective in Barbados. And for my time that I've been in Barbados since 2023, we have seen certainly the strides and championship that they have been doing. Secondly, just to respond to the comment on extreme heat, within recent, in the last few months, It has become a priority of the the special representative of the Secretary General for our office to look at extreme heat. So it is something that we are assiduously trying to figure out to define what is meant by extreme heat, because what may be an average day in Barbados can be an extreme heat day for the UK. And so those terminologies are being defined as we continue to navigate these new and emerging trends in terms of temperature, climate, and multi-hazard perspective, as well as the financial ecosystems that we are existing in. So rest assured, UNDR remains committed to supporting DEM in these events once we have that international level data and information gathered to provide that, vertical information and sharing opportunities. Secondly, I want to commend BARP on the opportunity that they are proposing as it relates to the registry. For us, it's absolutely important that everything must be risk-informed and data-driven. And so your approach to ensuring that this registry is established for data sharing, I think is important. For us, we are supporting right now the DEM in developing what is called a disaster risk information management system, where this same type of information will be placed onto it. And it allows us to understand what are the existing vulnerabilities, capacities, exposure, and what can be potential impacts based on impending hazard that will soon come. So, of course, we will support again where there's a need. I think we have a resource at DEM who works very hard. Captain here is Junior. So let's see how that can go forward. So I want to commend you on that. And thirdly, just to say that for us, the sustainability of any initiative is actually important, and not only sustainability in terms of financial resources, but human resources. And now as we navigate these new and emerging ecosystems in the financial landscape, for developmental partners, it's actually very important for us to take ownership of our responsibilities. We know that disaster risk reduction is not anybody else's business, but it's my business. And to ensure that leaving no one behind, as the Sendai Framework for Disaster Risk Reduction promotes, must start from home. And so we remain committed to supporting the cause and to advancing disaster risk reduction and resilience building in Barbados.
Thank you so much, Anwar. Thank you for your comments. And that's what it's all about. And we're so grateful for our partners. You recognize, Marilyn, that we don't operate in a vacuum at all when it comes to disaster risk reduction. UNDR has been a partner for DEM for years, and they've been very instrumental when we are doing a lot more community-driven outreach. More recently, we participated in St. Joseph in February for the Making Cities Resilient workshop, where we talk about how we can make our communities, our constituencies, more resilient. And one of the key things is information sharing. One of the challenges in Barbados is that we usually operate in silos. So the information that the Community Development Department has, they hold on to it. DEM has information, and it's only when crisis occurs that we see this cross-pollination of information sharing. But we need to have that consistently so that we can target those particular groups, whether through UNICEF looking at the rights of children and how they may be impacted during a disaster situation. Because we hear about horror stories across the world when, let's say, for example, after a war and persons are misplaced, women and children got to sell themselves literally to get food, to get water, to get housing. So it is important that we recognize the needs and the rights of individuals when crises occur. And more recently, myself and Captain here, we've been in a lot of dialogue with the UN's arm that deals with the International Organization for Migration. Because one of the things we have to consider now in Barbados, what if in a situation where the residents, the nationals of St. Vincent, after the eruption of the volcano said, hey, look, this country is no longer tenable. We're going to leave here. We need to find somewhere else to live. We saw to some degree during the eruption of the volcano in Montserrat years ago that there were a number of Montserratians that came to Barbados, and the process was quite orderly because the numbers were not that large, not significant. What if we have a situation now where after, let's just say, a military crisis, God forbid in Trinidad or in Haiti or Jamaica, and persons are literally fleeing for their lives, and they say, you know what, let's come to Barbados. And knowing the nature of our Prime Minister will say, hey, look, Barbados is here. we always open our doors to you, come. We have to consider how migration could be organized in an orderly way with regards to persons being misplaced. I hate the word refugee, so that's why I haven't said the word refugee, but displaced persons based on disasters, whether it is a humanitarian crisis, whether it's war, or because of disease. Those are the things we have to consider. How do we integrate those persons? How can we facilitate those persons coming to Barbados because of their fleeing due to a natural disaster, a disaster, not natural, a disaster, or vice versa. What if a situation in Barbados occurs? We are small. What if something major happens in Barbados, half of Barbados ends up in a sinkhole or whatever? We don't know. Where are Barbadians going to go? I see some of your faces here. And those of you online, you're hearing my voice, and you're seeing our debate. What would we do? Have you considered what would happen to you if you had to leave Barbados due to a major crisis? Or you may be living abroad and you hear that your sister, your brother, your mother, your relatives here in Barbados are stranded, be trying to get out, trying to leave Barbados to go elsewhere. Those are the things that we have to consider and plan for. The mass movement of persons, and not in an orderly way, the mass movement of persons because of a crisis. So those are things we have to consider. Are there any more questions before we move on? Those of you online, if you have any questions, just share them with us. We'll be more than willing to answer them for you. We also have representation here from the Welfare Department. Thank you so much for being here. Yes, this is Miss Carolyn Small. She's here. Thank you for joining us, because obviously as it relates to persons who are considered to be vulnerable, we have to consider those persons who, due to different circumstances, are part of the welfare system and would need assistance, whether it's in terms of housing, in terms of stipends and so on, or vouchers for food. So we have to look at things at the national level. We saw how Barbados had to adapt or pivot during COVID. Remember the days of lining up in alphabetical order to go to the supermarket? You all guys remember those days during COVID? If your last name was not Aline or King or Lord, you had a particular day to go out. I see some of you remembering.
And if you were blessed with rice boy,
Yeah, the RB.
I remember I went one day and I was insisting to the woman that I was going. And she said, no, you're rice. You know, so I said, okay, we shop as rice and then shop as boy.
She shopped as rice and boy, exactly the double barrel name. So those are the things that we have to consider. And the thing about it is that planning, that's where the Department of Emergency Management, along with its partners, and they're talking at the national level. We are already at the national level. We have certain mechanisms to activate. We monitor certain things. The Barbados Met Services plays a big role in terms of early warning and updates about weather and other climatic situations that might occur. So we are alerted, we are aware, but we are more concerned that at the community level, there may be challenges, because recognize that although Barbados is small, we deal with things at the sectoral level and at the macro level, and then we drill down to the community level. And that's why it's very important in times of crisis that your community operatives, that are DEOs, they have the manpower, they have the training, they have the radios, they're able to map the community and let us know what is happening. Right, I'm being told to check my phone. I think we may have a question here. Right, a question. Is the St. Thomas DEO active? Is there an emergency engagement toolkit? So in terms of question 2, I can speak to that. Emergency engagement toolkit. I think they're speaking more to procedures and protocols and what we do are at the emergency level, but it could just be referring to disaster preparedness kit at the personal level. All of the information that you want, I want to stress to those of you who are watching online, you can go to www.dem.gov.bb. We have a suite of information regarding hurricane shelters, regarding emergency preparedness at the home level, at the school level, and of course at the community level. So we have a lot of information on our websites. We also have the sedema.org website as well at the Caribbean Disaster Emergency Management Agency. So there's a lot of information you can glean from there. But the question was asked about the DEOs. I think Mr. Brooks can take this one and the work that they're doing to get the DEOs back up. So the question was asked if the St. Thomas DEO is active.
I think this question is very appropriate at this point in time because come Sunday the 16th, there is a community meeting at the Leicester Vaughan School at 4:30. Your question is quite point because, as I said, some DOs are not functioning at a level, and the St. Thomas DO has not been as active as we would have liked it to. And the purpose of having a meeting this coming Sunday, 4:30 at the Leicester Vaughan School, is to make the necessary presentation of what is the work and the functioning of the DO, and it's going to be focusing on this Sunday on our early hurricane preparedness, so that persons can have a great appreciation of what the DOs do and what is expected of them. So the person who have asked that question, I would like to extend an invitation to you and 5 other persons from your gap or your community or your family. Come on over to Leicester Vaughan School, 4:30 this coming Sunday, and we will be able to share some information. And it is the expectation. We have a similar meeting on the 23rd of this month at the Prerogative Center there in Greens. So the department is making a greater effort to see how we can mobilize those communities in which the DOs are not functioning at the level that we will feel good. And that is going to be an ongoing process. Next month in April, we will be coming to Christchurch South, and we also will be coming to Christchurch East, ironically the constituency of our minister. So therefore, it is a gradual process. It takes time to put these meetings and collaboration with community groups, churches, the schools, or whatever. But we are making an effort so that come June, we should have some of those DOs that are not as active, at least mobilized and seeking to get them to moving on. So I look forward to seeing that person on Sunday.
All right, so you heard it from the consultant for DEOs. So the question from our online viewer about the DEO in St. Thomas, you have a meeting this Sunday, 4:30 p.m. at the Leicester Vaughan School, where we can get the St. Thomas DEO active and up and running again. So I just want to say a special thank you for those who are here in our audience, but especially for those who are online. Your participation has been very invaluable. We want to thank our panelists again for taking time from their busy schedules to be here. I step up to the challenge, Marilyn. We will be doing work. I believe that Captain Herwood will be on my net. He said, but don't forget now that you promised you can do some work with BARP, put that as part of your work program. I appear, you're part of BARP, but I am actually a member of BARP, probably one of its youngest members. Well, not anymore. I joined at 40. I'm now approaching 44 quite speedily. I don't know why. I'll be 44 this year. But yes, being a member of BARP and the benefits, oh my goodness. I love the benefits of BARP when I go shopping. So, Marlene, keep up the good work. I also want to encourage your CEO. I think that's Stephen Allen. I want to encourage him. And Judith. Thank you, Judith, for assisting as well. We want to thank the whole team and management of BARP and its members who might be online as well. Yes, Dale Ford. Yes, Dale, thank you so much for your assistance. You've been working with us with DEM on different projects, so we are grateful. I want to thank the DEM staff members who are here. We have our PR unit at DEM that comprises of myself, Miss Tonya Blackman, consultant, program officer, Miss Julia Rollins Bentham. She came from GIS with lots of experience in public information and so on. So we use her, we work with her to make sure that we get things done. And also our consultant, Mr. Nathan Gibbons, who's responsible even for facilitating this streaming on our platforms. Thank you. We want to thank Fresh Holford and his team for the video as well as the live stream feed. It's been really good. The fact that persons can say that they're seeing us and hearing us quite easily. Thank you, Shane. Big ups to you and your team, as well as Selwyn. I also want to thank our assistant librarian, Miss Antoinette Clark. She was down in the back making the kind of some symbols and signals. I see you quite well, ma'am. You know, I can't miss you in that lovely flowered top. We thank you for coming out here and to assist us in our public information. We want to thank a young man here that wears many hats. He's a member of BCBRA. He's also a DEO member. What else? You do so much. Thank you for being here with us. I know you took time out from work to attend this lecture in person because you were not satisfied just to watch it online. I also want to thank our director, Miss Carrie Hines. We thank Miss Hines for her support and encouragement as it comes to finding new and creative ways to engage the public. We try to leverage technology so that we can reach persons at home or at work, wherever they are. And we also thank those persons who come out in their numbers in person to our lectures. So as I mentioned, Sunday, the 23rd as well, we have our Run Tsunami Run. That will be our challenge edition, a 5K run, going uphill and downhill in St. Joseph. And walk, yes, we push the walk. It's a 5K run and walk. There is a walk, yes, but for all the running clubs, we encourage you to sign up. You can go online to get more information about signing up for our Run Tsunami Run. There is no registration fee. You don't have to pay. All we require is that you make a donation of non-perishable items and or personal hygiene or personal care items so that we can use those items to make a charity donation. That's what we do at DEM every year based on we almost get close to two or three major barrels of donations. And then we choose a select charity, whether it's a children's home, whether it's Salvation Army or the Alliance to End Homelessness in Barbados. We make a contribution to those organizations. But we can only do it based on your donations. So we're asking you, you can sign up for the walk and the run. You get your shirts at DM, you get your bibs, but also you bring your donation of items for food banks and so on. And we are grateful that we could be here today. We want to thank the Barbados Light and Power and the use of this lovely, I really must say this is a lovely meeting room or conference room. And we thank you for assisting us in the live stream and everything. So thank you. So please give your regards to your chief. Let Mr. Blackman know that we're so grateful for his the use and his support. As always, the Barbados Light and Power is a player. They're a member of our Public Utilities Standing Committee. So we want to thank you for your participation. And for our friend that asked the question earlier, thank you. Your name is Julia as well? Judith. So we got Julia and Judith. Judith, thank you so much for your question and your challenge and your suggestion all in one. So we're going to try our best to include messaging for extreme temperatures and, of course, the possibility of drought, the fact that we need to take water preservation seriously in Barbados. I don't think I have missed out anyone. I just want to thank both the members of the Barbados Light and Power staff, both Corey and Nicole. Thank you so much for your assistance. And we look forward to all of your support. Please follow us on our social media pages. DEM is trending now. We're getting with it, young people, and the not so young. So you can follow us on our social media pages, on Instagram, on Facebook. And we're also on Twitter. It's called X now, right? We're on Twitter. And, oh, you don't go on X? Oh, so sorry. Well, you got your Facebook, you got your Instagram, and you can get information. You can call us at 438-7575. That is our office number. And we look forward to sharing information. If you're doing a project on disaster preparedness or on hazards in the community, go to our website, dem.gov.bb. If you want more information on our leaflets, you have digital leaflets and flyers that you can access information on multiple hazards. You can get that through DEM. We also have our physical leaflets. If you need to come to DEM, we have a small library. We have some dated materials there that might help you in terms of research. We offer those services. So thank you so much, and God bless. And thank you for tuning in to this special hybrid edition of our lunchtime panel discussion, discussing the topic, empowering communities to take charge of their own resilience. I am Simon Aline. Thank you.